When we look at today's numbers, today we are reporting 1,623 new cases of COVID-19. That's up a little since last Monday, but last Monday and today are significantly lower than what we have seen really for the past several months. And our Kentuckians currently hospitalized, 1,314 is down. Currently in the ICU, 337 down. Currently on a ventilator, it's up about 178, but overall those numbers are down from what we have recently witnessed. Our current positivity rate is up 0.04%, which, statistically I'm not sure is significant, but it remains below 9% again at 8.85%. We're now over 4 million total tests. I mean, we have 4.4 million people in Kentucky. We've administered 4 million tests over the last less than a year. I mean, these tests didn't exist until we started working this problem. And now the ability to do that is an incredible testament to so many across Kentucky. New cases by county: Jefferson 284, Fayette 114, Madison 111, Davis 83, Kenton 58, Warren 51. The rest are all under 50, and they can be found on kycovid19.ky.gov. I haven't provided race and ethnicity updates. They've been on the website, but we've seen significant movement from where we were in the summer, when especially our Black Kentuckians were dying at twice the rate that they make up the population, to certainly a better place. And I think it's thanks to a lot of leadership, a lot of interventions. Right now, when we look at deaths by percent, it is our white Kentuckians make up 87.81%. Black Kentuckians make up 8.78%. So just slightly over percentage of the population. When we look at multiracial, 2.72%, and everything else is below 1%. Our Hispanic population only makes up 1.83% of our deaths here in Kentucky. We do have more deaths, though, today and continue than we want to see. We're reporting 35 new deaths. This is, again, the result of that exponential increase that we saw, and certainly the post-holiday bump. Today's 35 include an 88-year-old woman from Adair, a 67-year-old man from Boone, a 69-year-old man from Boone, a 71-year-old man from Boone, a 56-year-old man from Boyle, a 72-year-old woman and an 89-year-old woman from Bullitt, and 4 men from Bullitt, ages 78, 79, 81, and 81. 67-year-old man from Callaway, 76-year-old man from Clay, 74-year-old woman from Clinton, 3 Fayette Countyans, a 97-year-old woman, an 87-year-old, and a 94-year-old man. 79-year-old woman from Grayson, 81-year-old woman from Harlan, and a 60-year-old man from Harlan. 60-year-old man from Harrison, 45-year-old woman, and a 78-year-old woman from Jefferson. And then men from Jefferson, ages 59, 67, 71, 77, 78, 79, and 95. 68-year-old man from Kenton and a 79-year-old man from Kenton. 90-year-old man from Lawrence, 88-year-old woman from Madison, and a 68-year-old man from Monroe. And for the first time, only 6 individuals from here right now we believe were in long-term care. I hope that's a sign that our early vaccinations and steps in long-term care are making a difference. But again, it should be a warning to all the rest of us. This can impact you whether you are in a long-term care facility or not. Update on our last week experience in schools. We had 1,330 students, K through 12, test positive last week, and 563 staff members. Newly quarantined students last week, 6,886. Newly quarantined staff, 911. think we currently have 18 high school sports teams that are quarantined. Long-term care, 576 total residents, which is 18 new that have active cases, 30 new staff members, 9 new deaths attributable to long-term care. Again, the growth there as our overall percentage of deaths, it's not growing. It's actually now decreasing, which means we're doing a better job, especially as the vaccinations happen.